Okay, so this is the machine of echocardiography, and I think you know this machine very well. This is a screen, and this is the I don't know what's called this. This is the keyboard from the for the echocardiography machine, and this is the analyzer. This is an analyzer, so it take the picture or take the waves from the body and analyzing here, or operate here or reacted here, and then the picture appear in this screen. Okay, let's talk about the echo. Before that, I want to mention one important thing, which is the ultrasound wave. So ultrasound waves, the frequency, the amplitude, how it's produced, how to the machine analyzed the equations and so on and so forth. This is not important for a physician to know. I think this is purely physics, and we are not a physicist. We are a physician. Just see the picture or see the videos, and then judge if the patient have a disease or not. So this is then echo machine. Okay, very important to know the axis of the echocardiography, because if you know the axis very well, you know how to reach to the heart structure, right atrium, right ventricle, left atrium, left ventricle, even aorta, and to see the abnormality there, if there is abnormality. Um, the axis of the axis of the echocardiography, the parasternal axis, which is very important axis to know, the apical axis, and subcostal axis, or sometimes called subxiphoid axis, because it's below the xiphoid process of the sternum, and suprasternal axis. Okay, so we have here, this is the heart. Okay, and you see this is the parasternal longitudinal axis. So parasternal longitudinal axis. So we cut the heart longitudinal from the apex to the base. Okay, and what are the structures? So what are the structure I should see? So the structure is here. So once you cut the heart parasternal longitudinal, so the structure is here. So you see here, this is the structure, and this is very important, which is the left ventricle, and this is the right atrium. This is the left atrium. This is the mitral valve, anterior leaflet, posterior leaflet, and this is the right coronary cusp, and this is the non-coronary cusp of the aortic valve, and this is the ascending aorta. Okay, before that, you should know how to put the transducer, where I can put the transducer to reach to this view. Very easy. So here you have a patient. Okay, and this patient, this is the sternum, and this is the parasternal area. And just in third or fourth intercostal space, I put the transducer. And there is, types of transducer. The smaller one, which is the best, and why? Because you can push in the intercostal space to reach to the heart, and to just pick up a very clear picture. Just ask a patient to do what's called a lateral decubitus, okay? Because the heart in this position is more closely to the chest wall, okay? Very important here, you see this is the transducer. The transducer pointed to the right shoulder, okay, from this side, and from the other side pointed to the left elbow, okay? And when you just do that, so you can get the picture of the parasternal longitudinal axis. And this is this is the picture. So this is the longitudinal parasternal longitudinal axis. Okay, so Again, this is a longitudinal axis, so parasternal longitudinal axis, and this is the real picture from the echo. Okay, so you see here, this is, from the illustration picture here, illustrating picture, this is the right ventricle, RV, anterior wall, interventricular septum, and the left ventricle and the posterior wall of the left ventricle. Okay, and don't forget here the aortic valve and the mitral valve. This is chorda tendineae attached to the papillary muscles, and this is, that this is the left atrium and this is the coronary sinus. Okay, how to cut the heart in the apical way, or in the apical, the short axis parasternal. Again, so this is the picture. Here you see this is a parasternal short axis view. And you can do that in the three view, or three pictures. You can get it. So at the level of aorta, the level of mitral valve, at the level of apex, and sometimes this is called the papillary axis. Okay, and this is a short axis. How to do that? It's easy. So this is the short axis. So remember that this is the parasternal longitudinal axis. You should just rotate the transducer 90 degree. Okay, I call this is the opposite side. So you just rotate it 90 degree, and you can pick up the short axis parasternal. So you see, this is a longitudinal, so a longitudinal axis, so pointed to the right shoulder and left elbow. Now 90 degree, you can just do that. So here, if you see that the pointer toward the left shoulder, okay, and the right elbow, okay, and then you can move it, okay, you can move it up and down, up to the aorta, at the middle, to mitral valve, and the pillow. You can get the papillary axis. Okay. So here you see that this is short axis of mitral and apical view, and if you just point it up or at the level, you can get the aortic valve. Okay. And lastly, if you want to get the apical view, so the apical view at the fifth intercostal space, at the point of the maximum pulse. Okay, so you just feel the pulse, and just when you feel it, you just put the pointer or the transducer there, and you can get the apical view. Again, this is the structure when you do a cut section of the short axis view. Not like, a longitudinal. So short axis, you just see the left ventricle, okay, which is a concentric, and the right ventricle, which is above, or it's anterior, okay, and it is eccentric, okay, not concentric, okay, and it's a very important view just to assess the left ventricular function of the ejection fraction. Again, this is a picture. This is a longitudinal axis. This is a shortcut axis. Okay, this is a shortcut axis. Okay, forget about these views. Okay, this is an apical view. Okay, if you want it, this is the apical view. Okay, forget about that. Okay. Now, this is a real picture of the echo. Okay. And I will see you what is the video, what's the real videos. Okay, so this is a picture, and the video is something else. So the video, it's all these structures moving. Okay, all of them moving. One thing's here, the picture here in echo, which is a triangular shape, or pyramidal, pyramidal, or the triangular shape. Which is a two-dimensional. Okay, everything here are anterior, in front of you, and everything here posterior. That means this is for example, the anterior wall of right ventricle, and this is the posterior wall of the left ventricle. That means the anterior wall of the right ventricle, which is anterior, and the posterior wall of the left ventricle, which is posterior. Okay, now this is again, this is a right ventricle. This is a right ventricle. This is an anterior wall of right ventricle. This is the interventricular cavity or right interventricular cavity, and this is the interventricular septum. And this is the aortic valve. Okay, right coronary cusp and the non-coronary cusp. And you know that the aortic valve contains three cusps. Okay. Why here in the echo picture appear two cusps, not three? Because this is a two-dimensional echo, not three-dimensional echo. So the two cusps appear. There is another view, which is the apical view. You can see the fourth or fifth chambers, four chambers, five chambers view, chambers view. You see the aorta, and she's the aortic valve with tricusps. Okay, and if the patient have a bicusp, it is very easy, very clear to pick up in this view. Okay, now you see the right coronary cusp. Why it's called right coronary cusp? Because the right coronary artery arising from here, but non-coronary there is no coronary artery arising from here. What is the cusp left, which is left coronary artery? The left coronary artery arises from there. Okay, you see this cusp is continuing with the interventricular septum, so there is a continuation between them. And if you lost this continuation, for example, if there is a gap between them, that means the patient may have VSD, bronchus arteriosus, or overriding of the aorta. Or transposition of great vessels, and so on and so forth. Okay, and to diagnose a VSD, okay, you can just see there is a gap between them, but to confirm that, you should do what's called the color flow Doppler. Okay, you see that the blue and red toward the transducer, blue away from transducer. And if there is a pathology, there is a mosaic color, orange, blue, red, and all of them mixed together, and you see the jet of the blood going to the right ventricle. That means the patient have VSD. Okay. Okay, this is the aorta. This is the ascending aorta, and if this ascending aorta get enlarged, okay, for example, if the patient have aneurysm or dissecting aorta, so you can diagnose that very easy by the parasternal axis, and it's compressing the left ventricle, the left atrium when the patient have aneurysm or dissecting aorta. Okay, now this is the anterior leaflet of the mitral valve. Anterior leaflet of the mitral valve, and if you see that in the video, after a minute I will show you the video. The anterior leaflet of the mitral valve is a finger-like. Okay, and it's coping with the posterior leaflet of the mitral valve. This is a normal, okay? And one thing here, I will mention that in the videos, the mitral valve opens 2 times, not 1 time, okay? So opens 2 times, okay? Because the blood now felt during a diastole, the blood felt the left atrium, and when during a systole, the blood felt in the left atrium, and during a diastole, the mitral valve open, and the large amount of the blood in the left atrium going to the left ventricle passively. Okay, that means without contraction. Okay, and more than 75% goes to the left ventricle. 25% ejected from the left atrium to the left ventricle by contraction. This contraction will open the mitral valve. Will open the mitral valve second time. Okay, so 1 time during a diastole, huge amount of the blood going from the left atrium to the left ventricle, and the second time when the atrium contracted, the blood ejected to the left ventricle, and the mitral valve opened again. Okay, and I will just discuss this again with the videos. The mitral valve look like a parachute-like, and why the mitral valve opened 2 times. I will discuss this later on. This is the posterior leaflet of the mitral valve. This is the left atrium. Okay, and if there is any mass, for example, this is the anterior wall. This is the posterior wall of the aorta, and this is the anterior wall of the aorta. Sometimes you might see here a pedunculated mass. this is a myxoma, for example, and it's attached to interatrial septum, you can diagnose this by the parasternal axis. This is, the posterior wall of the left ventricle. This is the infralateral wall of the left ventricle. And I will just discuss this later on in the video, how to just assess or judge the patient have a very good left ventricular function or not. Okay, because the interventricular septum and the posterior wall of left ventricle contracting simultaneously in a synchronized manner. Okay, and the ventricle cavity will narrow. Okay, and this is during systole. During diastole, the ventricle will come back again to the normal size. Okay. Okay, let's talk about now, or let's go to the video and see the videos. Okay, this is a real picture of the parasternal longitudinal axis. And I said to you, everything here moving. Okay, again, this is the anterior wall of the right ventricle, this is the interventricular cavity, and this is the interventricular septum. This is the right coronary cusp, which is the upper cusp, the lower aortic cusp, which is the non-coronary cusp. And if you see there is a continuation between them, that means the patient mostly don't have VSD. And if you see, this is the mitral valve, this is the anterior leaflet, this is the posterior leaflet, this is the chordae tendineae, and this is the papillary muscle, this is the posterior wall of the left ventricle. Okay? Two things here I want to mention. You see, this is the mitral valve, and you see the mitral valve moving 2 times. That means opens 2 times. Okay, 1 time, as I said, the blood during a systole, okay, coming from the pulmonary veins from the lung to the left atrium and filled the left atrium. And during a diastole, so about more than 75% of the blood goes to the left ventricle. Okay. And when the blood filled the left ventricle, so the blood filled, and start to closing the 2 mitral valve. Okay, so something that arising the mitral valve above and closing to each other. But as I said, 25% of the blood left in the left atrium. Now the left atrium contracted and ejected and opened it again. Okay, so this is the mitral valve. And when you have for a disease, for mitral stenosis, you have finger-like, and if the patient have Dooming-like, that means the patient not have this this straight-like line, or this is this finger-like. The patient have Doom-like. Okay, this is a mitral stenosis, and we'll talk about that later on the video on the videos in the future. In the in the separate manner. So mitral valve, I will discuss a mitral valve in the separate videos. Okay, here if you see here, this is the interventricular septum, and this is the posterior wall of the left ventricle. And if you see, then it's contracting and simultaneously in a beauty manner, in the synchronizing manner. That means the interventricular cavity narrow, and when during a diastole, the left ventricle come back again. Okay. One thing here also I want to mention, you see this is the descending aorta. Okay, and this is a very, very important landmark to just differentiate between pericardial fluid and pleural fluid. If the fluid above the descending aorta, this is the pericardium, if the fluid above it, that means the patient have a pericardial effusion. If the patient have a fluid in front to the descending aorta, that means the patient has pleural effusion or pleural fluid. This is not pericardial effusion. Sometimes the patient have both, have a pericardial effusion and a pleural effusion. For example, patient have renal failure or heart failure, okay, cardiomyopathy, for example, may have both. Okay. As I said, you can just assess the left ventricular function if this muscle not contracting well. I can say this patient have decrease in the left ventricular function. Another way around, this patient have definitely decrease in ejection fraction. And to just be more clearer and more, more oriented, just to do what's called the M-mode echo. Okay, M-mode echo, this is a multiple view of the cardiac structures in a multiple variety periods of the cardiac cycle, and you just record this in the echo. For example, if you want just to cut here, just one line to cut here, just what are the structure you should see in this view. You see the right ventricle, interventricular septum, and the cavity, and the posterior wall of the left ventricle. And if you want to cut here, this is a mitral mode, you see the mitral valves, and all of this, fortunately, all of these structures. And if you cut here in the aortic valve, the anterior leaflet and the posterior leaflet will be, you will see it in the M mode. Now let's talk about the M mode. Now I will just cut the heart at this level. That means the septal, the right ventricle and interventricular septum, and the cavity and the posterior wall will appear, and how to to assess the left ventricular function. Okay, so if you cut the heart here, this is the parasternal longitudinal axis. If you cut here, this is the picture. This is a picture you should see. So I cut the heart like this, okay, vertical, not longitudinal, okay. And you see here, this is the interventricular septum. This is the interventricular septum, and this is the interventricular cavity, okay. And this is the posterior wall of left ventricle. As I said, during a systole, it's relaxing at the same time, and during a systole, contracting at the same time. That means there is a synchronism between them. That means I can measure the distance here during a systole, and the distance here during a diastole, and the distance during a systole. And just the machine will calculate that, and it can measure the ejection fraction of the patient. Okay. Now the mitral valve. If I want to cut here in the mitral valve, this is the mode of mitral valve. Now this is the interventricular septum, and this is the mitral valve. This is the anterior leaflet of the mitral valve, and this is the posterior leaflet of the mitral valve. And here the valves open. This is during a diastole. And during a systole, the two valves closed at the C point, okay, to the D point. The two valves closed, okay. Now during a diastole, the two valves open. This is the anterior leaflet of mitral valve, and this is the posterior leaflet of the mitral valve, okay. And you see here there is a two wave of mitral valve. This is called the E wave, and this is the A wave. And this is a very important, necessary information to know, because if this wave changed, that means if you have an E wave lower than the A wave, that indicates something. Or another way around, if the patient have an A wave, the A wave is larger than the E wave, that means the patient have, for example, a stiff ventricle. I think you heard about the fourth heart sound. Fourth heart sound, when you have a stiff ventricle, the left atrium contracting against the stiff ventricle to just push the blood to the left ventricle. Okay, that means the patient have a stiff ventricle. That means the patient not have a healthy ventricle. Okay, and if you just lost the A wave, that means the patient have atrial fibrillation. Okay, so you can diagnose a disease from this description. Okay. As I said, very important to know the waves, or A wave and E wave and C point, and then this is during the systole. Then the diastole opens, so it opens. Okay, and just like I like to describe that this is like a butterfly. Okay, so if you see, that's like a butterfly. Okay, it's like a butterfly. Okay, so during a systole closing, during a diastole opening, during systole closing, during diastole opening. I have another one here. This is another one, normal. M mode, parasternal at the mitral valve, longitudinal axis. You see this is a 2-wave, this is an E wave, and this is an A wave, this is an E wave, and this is an A wave. So during the systole closing, during the diastole open, this is the posterior leaflet of the mitral valve. Okay, now this is a mitral valve. Let's talk about the aortic valve. So now I cut the heart from here at the level of the aortic valve. Now this is the this is the aortic valve. This is the aortic valve. Now I cut my section here at the level of the aortic valve. Now it's very easy to know. So this is this is the right ventricle wall. Sorry, this is the right atrial wall, and this is, as I say, this is the left ventricle. Okay, this is the left ventricle, or the left atrial wall. Okay, this is the left atrial wall. Okay, this is the right atrial, and this is the left atrial wall. And if you see here, this is the aortic valve. This is the right coronary, non-coronary cusp, so closing during a systole, and during a diastole closing, and during a systole open it. So, and give you a very important, this is a pox-like. Okay, so during the systole give you a pox-like. So during a systole, the aortic valve is open, because you see this is a contraction ECG, and after the QRS, the aortic valve opened. Okay, so this is a pox-like. When you have a problem, for example, so this is, if you see, this is a line here, and if you just have a funnel-like, that means the patient may have a problem with ejection fraction, or with the function of the left ventricle. Okay. Okay, I think this is what I want to mention. Again, this is this is a view of the parasternal axis. If you just liked my video, just give me your like and your subscribe, and I will just do another videos for echocardiography and for disease of the cardiology. Thank you very much for your listening, and for watch the movie.